1. Be patient and rest. Your cervical spine, neck, is a complex collection of bones, joints, ligaments, nerves, muscles and blood vessels. As such, there are many structures that can generate pain if you move your neck the wrong way or experience some trauma, such as whiplash. Significant neck pain can come on quickly, but it can sometimes go away just as quickly, without any treatment, because the body has a fantastic ability to sort itself out and heal. Thus, be patient for a few hours if you experience a bout of neck pain, avoid any strenuous or irritating activities and keep a positive attitude. Neck injury symptoms that indicate you should immediately seek medical attention include severe neck pain that gets progressively worse, muscle weakness and/or loss of sensation in your arms, throbbing headache, blurry vision, loss of balance and/or nausea. Resting your stiff or painful neck is a good idea, but completely immobilizing it in a neck collar or brace is not recommended for most injuries. It promotes weak muscles and less mobile joints. At least some gentle neck movement is needed to encourage blood flow and stimulate healing. If your neck pain is exercise-related, you may be working out too aggressively or with bad form. Talk to a personal trainer. 2. Apply cold therapy for acute pain. The application of cold therapy is an effective treatment for essentially all acute, recent musculoskeletal injuries, including neck pain. Cold therapy, whether it be ice, a frozen gel pack or a bag of veggies from the freezer, should be applied to the most painful part of your neck in order to reduce inflammation and pain. The cold causes the local blood vessels to constrict, which prevents excessive swelling, and it numbs small nerve fibers. Apply cold therapy for 15 minutes every hour for the first 3 to 4 hours post-injury, then reduce the frequency as the pain and swelling subside. Compressing the ice, heat as well, against your neck with a stretchy bandage or elastic wrap will also help combat inflammation, but be careful not to completely cut off circulation. Wrap frozen items in a thin towel in order to prevent skin irritation or frostbite on your neck. Acute pain typically lasts for less than a few weeks, but can transition into chronic pain if it lingers for a few months or longer. Keep in mind that cold therapy may not be appropriate for chronic, long-term neck pain that doesn't involve much inflammation. Applying moist heat may provide more relief. 3. Apply moist heat for chronic pain. If your neck pain has become chronic, lasting for a few months or longer, and feels more stiff and achy instead of inflamed and painful, then avoid cold therapy and apply moist heat. Microwavable herbal bags are tailor-made for neck pain and work well for relaxing the tension in muscles and reducing achiness in spinal joints, especially those products that are infused with aromatherapy, such as lavender or rosemary. Unlike an acutely injured neck, chronic neck stiffness benefits from the increased blood flow that heat provides. Apply the herbal bag for about 20 minutes at a time, up to 3x daily. As an alternative, soak your chronically sore neck and shoulders in a hot Epsom salt bath for 20 minutes. The hot water improves circulation and the magnesium-rich salt works well to reduce ligament and tendon tension, joint stiffness and pain. Applying some form of moist heat to your neck just prior to performing stretches, see below, is a good idea in most instances because it will make the muscles more pliable and less likely to become more strained. 4. Take pain medication short-term. Consider taking over-the-counter non-steroidal anti-inflammatories (NSAIDs) such as ibuprofen, naproxen or aspirin for acute neck issues, but keep in mind they are best used as short-term solutions to help you deal with inflammation and pain. These drugs can be hard on your stomach and kidneys, so try not to use them for more than 2 weeks at a stretch. Always remember that aspirin and ibuprofen are not appropriate for young children to take. Alternatively, if your neck is more stiff than inflamed, you can try over-the-counter analgesics such as acetaminophen, Tylenol, which is much easier on your stomach, but can negatively impact your liver. If muscle spasm or guarding is a major element of your neck pain, common with whiplash injuries, then consider taking muscle relaxants such as cyclobenzaprine, but never take them concurrently with NSAIDs. Check whether muscle relaxants are available over the counter where you live. As a general guideline, achy pain is usually indicative of a muscle pull or tightness, whereas sharp pain with movement is often caused by joint, ligament injuries. 5. Do some light stretches. Whatever is triggering your neck pain, chances are that the surrounding muscles are reacting to it by getting tight and restricting movement. Therefore, as long as you don't feel sharp, electric or stabbing pain with neck movements, which may indicate a disc herniation or a bone fracture, then light neck stretches are likely of benefit. Sore and tight muscles respond well to stretching because it reduces muscle tension and improves flexibility. Doing stretches and neck movements after a warm shower is helpful, regardless if your neck pain is acute or chronic. Good mobilizations to start with include shoulder rolls and circular movements with your head. Then progress to neck rotations, looking side to side, and flexion, extensions, looking up and down. Spend a few minutes on each set of movements. Once your neck is warmed up, start stretching by laterally flexing your neck and head, trying to bring your ear closer to your shoulder. Do both sides. Then flex your neck forward, chin to chest, and slightly rotate it to the side until you're staring down at your foot. Switch and do the other side. Hold all neck stretches for about 30 seconds per side while deeply breathing and do them 3 to 5 times daily until the pain diminishes. Always stretch or move your neck within pain tolerance. If you stretch your neck and feel pain, gradually bring your neck back to where you don't feel any pain. Do not stretch beyond that point. Over time, your range of pain-free motion will gradually increase. 6. Don't sleep on your stomach. Stomach sleeping is a common cause of neck and shoulder pain because the neck gets twisted to the side for long periods of time to allow for breathing. Excessive neck twisting irritates the small spinal facet joints, ligaments, tendons and nerves of the neck. The best sleeping position for your neck is either on your back or on your side, similar to the classic fetal position. Stomach sleeping is a difficult habit to break for some people, but the benefits to your neck and the rest of your spine are worth the effort to switch positions. While on your back, don't prop your head up with more than one pillow as the increased neck flexion can lead to pain. While on your side, choose a pillow that isn't much thicker than the distance from the tip of your shoulder to your ear. Pillows that are too thick cause too much lateral flexion in the neck. Consider buying a special orthopedic pillow for your neck. They are designed to support the normal curves of your neck and prevent any irritation or sprain while you sleep. Check out the link description below.